Hello, on today I will be presenting on thermotherapy, and my name is Lyric Turner. What is thermotherapy? Thermotherapy is used to decrease pain, promote relaxation, decrease muscle spasm, lower skin impedance, decrease the stiffness of joints, promote collagen extensibility, increase local tissue metabolism, promote vasodilation, and accelerate healing. Thermotherapy. Thermotherapy consists of application of heat for the purpose of changing the continuous intraarticular and core temperature of soft tissue with the intention of improving the symptoms of certain conditions. The goal of thermotherapy is to alter tissue temperature in a targeted region over time for the purpose of inducing a desired biological response. The majority of thermotherapy are designed to deliver the thermotherapy to a target tissue volume with minimum impact on intervening or surrounding tissues. Thermotherapy can be used in rehabilitation facilities or at home. There is a picture showing someone or athletic trainer or whoever she may be applying a heat pack on someone to show thermotherapy. Findings of evidence in Article 1. So I had found an article called Heat Therapy with the author of Winsheng, and he was basically talking about both cold and warm receptors discharge minimum at 91 Fahrenheit and discharge maximally between 99 Fahrenheit and 104 Fahrenheit. At a temperature greater than 113, the pain receptors are stimulated again. This explains how proper application of superficial heat will reduce pain, but high temperature will induce pain. Thermotherapy relaxes muscles by decreasing the stimulus threshold of muscle spindles and decreasing the gamma efferent firing rate. So remember, thermotherapy is used to increase tissue temperature and is divided into superficial and deep heat. Superficial heat is the penetration of heat that is superficial and usually less than 1 centimeter deep, whereas diathermy can reach as deep as 3 to 5 centimeters without heating superficial tissues. Superficial heat is applied for the absorption of energy in a subcutaneous tissue, which causes its temperature to rise and continuous blood flow to increase. There are 3 types of sensory receptors that are found in superficial tissues, which are cold, warm, and pain. So right there is talking about superficial versus deep heat and how superficial heat is applied to absorb the energy. Here in Article 2 is a different type of article, but it's titled the same thing, Heat Therapy, which is by Y.F. Lin. And he was talking about the moist heat is more effective at warming tissues than dry heat because water transfers heat more quickly than air. The result in the perception that the tissue is heated more deeply, which increases the effect on muscles, joints, and soft tissues. The author also states that IR radiation is a convenient system to heat parts of our body. It has the advantage over direct contact in that radiation because heat is applied directly to the area where the blood capillaries and neuron terminals are. Thermotherapy is the application of heat to the body, as we know. Some thermotherapies that are used can be the hot clot, hot water, ultrasound, heating pad, whirlpool beds, IR, which is stands for infrared heat therapy, etc. The benefits of thermotherapy to those with soft tissue injury, non-infectious arthritis. Thermotherapy is a vasodilator and it should be avoided in tissues with inadequate blood supply. Acute injuries, bleeding disorders, tissues with severe lack of sensitivity, and scars because it's dealing with heat. So, a summary of what I learned is that thermotherapy is the application of heat that decrease pain, muscle spasms, stiffness of joints. Thermotherapy can relieve pain by the applying heating pads to an injury. Thermotherapy can relax the muscles from an injury by using an infrared heat therapy method. I'm going to attach link, the video link to the discussion board because I would like for y'all to look at it. It's just pretty much showing heat therapy and how they're applying it to someone.